discussing about types of hair disorders, then causes of hair disorders, then patterns of hair loss, and at the end of the video, I will be discussing about treatment of hair loss. Now let's first go through types of hair disorders. The first hair disorder which I am going to discuss here is anagen effluvium. Effluvium means shedding. You know there are three phases of hair cycle: anagen, catagen, and telogen. Anagen is also known as growth phase, in which hair follicle starts to grow. Therefore, in anagen effluvium, there is shedding of anagen hair follicles. And anagen effluvium is due to chemotherapy. You may have seen cancer patients who lost their hair, and that hair loss is due to anagen effluvium. In anagen effluvium, there is diffuse shedding of anagen hair follicles. Now let's see second hair disorder, that is telogen effluvium. In telogen effluvium, lots of premature anagen hair follicles rapidly enter into telogen phase. You know, telogen phase is also known as dying phase, and it lasts for 3 months. After completion of 3 months, all the hair follicles which were present in telogen phase are lost. That means in telogen effluvium there is increased loss of hair. And telogen effluvium is seen after pregnancy or in typhoid fever or in any long-term illness. Now let's see another hair disorder, that is androgenetic alopecia. Alopecia means hair loss, and this androgenetic alopecia can be due to hormones and can be due to genetic factors. There is another type of hair disorder, that is alopecia areata. This alopecia areata will be discussed in next lecture. Now let's see which androgen hormone is responsible for androgenetic alopecia. The precursor for the androgens is dehydroepiandrosterone, or simply DHEA. This DHEA is converted into androstenedione by the help of an enzyme, that is 3-beta hydroxysteroid dehydrogenase. And this androstenedione is converted into testosterone by the help of an enzyme 17-beta hydroxysteroid dehydrogenase. Then this testosterone is converted into dihydrotestosterone by the help of an enzyme called 5-alpha reductase. This DHT, dihydrotestosterone, is a potent form of androgen, and this DHT is responsible for the hair loss. Now let's see clinical features of androgenetic alopecia. Due to DHT, dihydrotestosterone, patterned hair loss is seen. What does it mean, patterned hair loss? Patterned hair loss can be male pattern or female pattern. Male pattern can be Hamilton pattern, and female pattern hair loss can be Ludwig pattern hair loss and Olsen pattern hair loss. Hamilton pattern hair loss includes frontal recession, temporal recession, hair loss from the vertex. What is frontal recession? Frontal recession means frontal hairline is receded backwards. Let's see in this picture. Here you can see the frontal hairline is lost, or you can say the frontal hairline is receded backwards. Temporal recession means hair loss from the temporal side of head, and the hair loss from the vertex can also be seen in the Hamilton pattern. Here also you can see the hair loss from the vertex. Here in this picture also you can see the hair loss from the vertex and the frontal recession. In Ludwig pattern, the frontal hairline is maintained. You can see here in this picture the frontal hairline is maintained, but there is diffuse hair loss of frontal portion and vertex portion. On the other hand, in Olsen pattern, the frontal hairline is also maintained. As you can see here in this picture, the frontal hairline is maintained, but there is hair loss from the partition side. You can see here the partition side hair loss is seen in the Olsen pattern. Here you need to remember two important points, that in both male pattern hair loss and female pattern hair loss, miniature hair is seen in reduced anagen phase. What does it mean? Miniature hair means small hair, and anagen phase is also known as growth phase, in which the hair follicle starts to grow. If this anagen phase is reduced, that means the size of the hair follicle will also reduce. Therefore, in a reduced anagen phase, you will see miniature hair. Also, in both male pattern and female pattern hair loss, villus hair increases and terminal hair decreases. Villus hair is thin, weak, and light colored hair, and terminal hair is thick, strong, and dark colored hair. Now, let's talk about treatment of androgenic alopecia. We give topical treatments, and in topical treatments, we give minoxidil. The mechanism of action of minoxidil is that it is a potassium channel opener. Due to potassium channel opening, vasodilation occurs, and due to vasodilation, there is increased blood flow to the hair follicles. And whenever there is increased blood flow to the hair follicles, there is increased anagen phase. Anagen phase is also known as growth phase. Therefore, there is increase in the growth of hair follicles. Therefore, you can say the minoxidil reverses the miniaturization of the hair follicles. Minoxidil is US FDA approved drug, and it is used in both males as well as in females. In case of males, 5% minoxidil is recommended, and in case of females, 2% minoxidil is recommended. But in markets, 10 to 12% minoxidils are also available. We can also give systemic agents like 5-alpha reductase inhibitors, which include finasteride. Finasteride is given 1 mg once a day, and it inhibits type 2 5-alpha reductase. Whenever the type 2 5-alpha reductase is inhibited, the conversion of testosterone into dihydrotestosterone is also inhibited. Therefore, the hair fall is prevented. There is another drug which is known as dutasteride. Dutasteride inhibits both type 1 and type 2 5-alpha reductases. The type 1 5-alpha reductase is present in prostate. Therefore, dutasteride is used in treatment of benign prostatic hyperplasia (BPH). And remember, finasteride is used only in males, not in females. We can also give androgen receptor blockers like phylutamide. Phylutamide can be used in both males as well as in females, but it has a side effect that it is a hepatotoxic, and it is not a first line treatment, it is a second or third line treatment. Anti-androgens can also be used like cyprotrone acetate and a diuretic called spironolactone. Spironolactone is also having anti-androgenic activity. Anti-androgens are having side effect in males, that is virilizing side effect. Therefore, anti-androgens are only used in females. If above medical treatments are not helpful, then go for surgical treatment, that is hair transplant. There are two techniques of hair transplant. The first one is called follicular unit extraction or FUE, and the second technique is called follicular unit transplant or FUT. Follicular unit extraction technique is commonly used, and it is an advanced technique because after surgery no surgical scar is left. But in case of follicular unit transplant, surgical scar is left after the surgery. Hope you have enjoyed this video. Please make subscribe my channel. Thank you.